Hello everyone, myself Dr.Priya Varshney and I am a fertility specialist practicing at Cloud9 Hospital, Gurgaon. So nowadays infertility is rising in the Indian population and especially in the metro cities. So the cause may be due to changes in the lifestyles, due to changes in the delay in the childbearing age, and due to maybe the increasing environment pollutants. So here I am to give you about few tips about how to conceive naturally. So there in this video we will try to cover three important points. Number one, that what are your chances of natural conceptions in a single natural cycle? Number two, what all you should know about your fertile period and about these ovulation tracking kits and apps. Number three is, are there any special precautions which you should take after intercourse to increases your chances of conception? So here we go with the first question is, what are your chances of conceiving naturally in a single cycle? So if we talk about young fertile couples, then chances of conception in a single menstrual cycle is around 20 to 30%. And the chances of conception are maximum during first 3 months of trying. And if we talk about the 1 year, the chances of conception increases up to 80%. So if couple desirous of a October baby, so they should not be in hurry that the pregnancy should click in this month. So there is a natural body physiology, and it takes time to conceive naturally in a single month or within the first 3 months. Number two is what you should know about your fertile period. So if we talk about a 28 to 30 days cycle, the fertile period happens to be around day 11 to day 16th. That means the ovulation normally happens on day 12 or day 14. So if a regular unprotected intercourse even on alternate days is tried during this fertile period, it give a maximum chances of conception. So but the ovulation day can be different in each menstrual cycle. So that's why we kept a window of around day 12 to day 16. What about these ovulation tracking apps and ovulation kits? These ovulation kits detect, LH surge. LH is a hormone which rises around 24 hours before ovulation. So these kits detect the LH hormone, but this rise is not sustained and it is very transient. So and we do this LH kit only once in a day. So this ovulation prediction kits can be false negative in around 20 to 30% of cases, and these ovulation tracking apps and kits can be of use when the cycle is regular. It is not applicable in a woman whose cycles are irregular. So about the third question is, are there any precautions after intercourse which should be followed for trying for maximum chances of conception? According to the scientific studies, there are no specific position recommended for intercourse which increases the chances of conception. Even though some patients ask that bed rest after intercourse is advisable or not, according to the medical literature, it is of no use, and there are no specific position recommended to increases the chances of conception. So in a nutshell, you should use a young fertile couple should try for at least 3 to 6 months to try for the natural conceptions, and if it is not happening even after a year, they should meet the doctor. Number two, the fertile period usually happens on day 12 to day 16 in a regular cycle. So if the cycles are irregular, then couples should meet a fertility specialist. And number three, there is no specific position during intercourse, or no bed rest after intercourse is not recommended to increases the chances of conception. So if you have any irregular periods or having any sexual dysfunctions, then you should meet a fertility specialist before planning your pregnancy. Thank you.